there has been discussion on this very issue. China's health authority has been following the principle of transparency, openness, and a sense of responsibility. We have been disclosing our information, sharing experiences, and promoting international collaboration. I'd like to summarize our principled position in 3 ones. First, we reported the information and informed the WHO as soon as we got the information. And the second one was that we timely shared the genome sequence of COVID-19 virus the first time we got it. Third, we promoted international cooperation at the earliest stage possible. Let's trace back to the short history. After the COVID-19 broke out in April, in late December, the health authority in Wuhan, at the end of December last year, issued a notice on improving observation over atypical pneumonia. You may have noticed that in a TCM hospital in Hubei, a doctor named Zhang Jike, during his diagnosis, found 3 suspicious atypical pneumonia patients and reported it to the health authority in Wuhan. And the health authority in Wuhan found it important and asked other hospitals to proactively collect similar cases. After the notice was given on 31st of December, National Health Commission and the CDC sent an expert panel to assist further investigation in Wuhan to learn further about the outbreak. On January the 3rd, despite the fact we didn't know the exact reason, we reported the atypical pneumonia to WHO. At the first time the information was available to us, we also reported it to United States and other countries. And starting from January the 3rd, we also reported our prevention and control and study and research on the virus. CDC director from both China and United States had a video conference on 12th the 31st. We told them that we have found these atypical pneumonia. We looked at the possibilities of joint research. On January the 9th, we successfully separated the genome sequencing, and we confirmed that the coronavirus was a major pathogen for causing the disease. So on January the 9th, the date on which we found the information, we reported this to WHO and shared it with other countries.
Then on January the 12th, the genetic sequence was shared with WHO. Also, at the same time, we submitted the genetic sequence to the global influenza database. That means this is, for the influenza database, this is an internationally shared platform. So with the genetic sequence information available, the world is now able to study and develop the vaccines against the coronavirus. So this is the biggest contribution made by China to the whole world. And then on January the 25th, we had the on-site visit to Wuhan. And then from February the 12th to February the 16th, we had the joint mission from WHO and China, and I had the honor to be one of the one of the expert team members. The team visited Beijing, Sichuan, and Guangdong, as well as Hubei, Wuhan. In this team, and there are experts from all over the world, including U.S. And then on March the 23rd, U.S. Embassy representatives took part in the international experience sharing organized by NHC. And then on March the 25th, China CDC and the US CDC once again held a video conference exchanging experience in pandemic response. So with this timeline, you can see clearly that China's response to COVID-19 has been open, transparent, timely, and responsible. Faced with the global spread of the COVID-19, countries in the world should uphold the principle of respecting science, facts, and solidarity to respond to COVID-19. Only by the national and international solidarity can we enjoy the chance to overcome COVID-19 and control its spread in the world, and can we gradually recover the normal lives and production in the world.